Hi, I'm Dr. Stacie Grossfeld. I'm an orthopedic surgeon in Louisville, Kentucky. I'm going to talk a little bit about frozen shoulder. What is a frozen shoulder? Well, it's when you develop loss of range of motion of your shoulder and you just can't move it through a full range of motion. It's most commonly in women. In fact, 70% of the time it is women. Only 30% of the time do we see men that actually develop a frozen shoulder. And we're not really sure why there's a difference in gender between men versus women. The worst cases are patients who are diabetics. In fact, 20 to 30% of patients who have diabetes will develop a frozen shoulder. So we do know that when you present with a frozen shoulder and you are a diabetic, you tend to have a much worse case of adhesive capsulitis or a frozen shoulder than someone who doesn't have diabetes. What happens with a frozen shoulder is you will slowly lose your range of motion. There's usually not a trauma or any sort of inciting event, but you'll notice that you have more trouble kind of reaching behind in the car, and then if you're a man, you have trouble getting your wallet out of your back pocket. If you're a woman, you might have trouble fastening your bra. But you'll just notice over time, you start to lose that range of motion. And it's very painful. As you lose the range of motion, if there's ever a time where you try to quickly move your shoulder and you try to move it past that area where it's frozen, it's extremely painful. How do you fix a frozen shoulder? Number one, we recommend a cortisone injection. You go see your friendly orthopedist. They will do a cortisone shot into the shoulder joint. And after the cortisone shot has been done, it's very important that you have physical therapy. So the cortisone helps reduce the inflammation. The physical therapist will help to kind of push through and break up that scar tissue that has occurred with the frozen shoulder. So both of these are very important that you do them in tandem. On occasion, if there is no response from the cortisone shot and the physical therapy, you might need surgery. And surgery can either be what's called a closed manipulation, which is where you go to sleep. You'll meet the anesthesiologist who will put a nerve block in your arm. They will then briefly put you to sleep, usually less than 2 minutes. Your orthopedic surgeon will then gently move your arm through a full range of motion, which breaks up the scar tissue. You will then see your physical therapist that day, the day your arm is still numb, because that nerve block usually will last about 18 hours. You'll see your therapist typically 5 days a week for 2 to 3 weeks, and that should take care of it. At that point, the scar tissue has been released. The physical therapist will maintain your range of motion. Now, there's some cases where we do the manipulation, you do the physical therapy, and you still have a recurrent problem. If that happens, you would then need an open or surgical procedure where your orthopedist goes in with the arthroscopy, which is a shoulder scope. So I put the scope right into the shoulder joint, and then I go ahead and release the scar tissue and actually release the front part of the shoulder called the capsule and the back part of the shoulder, the posterior capsule, and that usually takes care of it. So the majority of the patients do great with just the physical therapy and cortisone shot, and on rare occasion we do have to move to a surgical treatment. Thank you.